Hello everyone, I am Dr. Pramod Reddy. I am the Clinical Director, Cardiothoracic and Vascular Surgery, Aortic Surgeon and Minimally Invasive Surgeon in Care Hospital, HITEC City, Hyderabad. So today I am going to discuss regarding aortic aneurysm surgery. So what is aortic aneurysm surgery and how is important to know about the basics of aortic surgery. So aortic aneurysm is an expansion of the aorta. So normally the aorta is normal range is there. If it's double the size of the aorta, the normal range, then it is called an aneurysm. So there are different places where the aorta increases. So if it is increased at the root, ascending aorta, arch and the descending aorta. So these are the normal parts of the aorta. So when the aorta is dilated, so when we say it is dilated means if the aorta is more than 5 to 5.5 centimeter, that is the time we have to do surgery. So if you don't do surgery, there are high chances of having a dissection in the future. So early detection is very important so that we can do this surgery at a very minimal risk. So once we do this surgery, the patient recovers and then it recovers faster. What are the causes of having these aortic problems? One is genetic. Some patients, they are born with a thin tissue or this abnormal tissue which doesn't support the aorta. The other one is the bicuspid aortic valve. In 2% of the population, instead of having a 3 cusp in the valve, so there are only 2 cusps. So that is the reason the aorta or the aortic valve is not able to sustain the pressure of the body. So that is the reason it starts degenerating and it starts giving up, and then the patient will have a severe AR in 3rd or 4th decade of life. The other one is atherosclerosis over the period of time because of hypertension and then old age. The atherosclerosis develops and then the aorta starts becoming weak and weak. Other one is connective tissue disorders like Marfan syndrome, and then some other connective tissue disorders are also there, especially in the females. Those connective tissue disorders also will weaken the aorta. Plus some inflammatory causes are also there like Takayasu, arteritis. Those diseases also will affect the aorta. So when the aorta is damaged, there are options are there. Sometimes we do stent or sometimes we do surgery. The surgery in a younger patient is better because the long-term results of the putting a graft or replacing the part of the aorta is there. The stent, when the patient has a comorbidity and patient is not fit for surgery, we do stent surgery. So in general, so what we do this patient, these are complex surgeries, and then sometimes depending upon where the tube is dilated, depending upon that one, we have to do surgery. So we have all the facilities to monitor neurologically as well as hemodynamically in our setup, so that we can do this surgery comfortably and with good results. So these surgeries involve aortic root surgery, which is called Bentall surgery. Then other surgeries are aortic arch surgery. Then we do elephant trunk technique, and we do a frozen elephant trunk technique. Then on the left side of the heart, we do left side of the chest, we do a thoracic aneurysm surgery, thoracoabdominal aneurysm surgery, abdominal surgery. Wherever the parts are dilated, depending upon that one, we have to replace, and then we have to choose a surgical strategy. Sometimes we do it on a complete cardiopulmonary bypass. Sometimes we do it on a left heart bypass. Sometimes we do it on deep hypothermic circulatory arrest. These are little high risk surgery compared to the normal surgery, but we can do this surgery with good results in our setup. Thank you.